Hello, it is the Cluster Buster, and we're talking about
carpal tunnel.
Yeah, it's more common than you think. If you're waking up with numbness, tingling, or pain, more specifically in the area like your thumb, your index finger, and even your middle finger, and if it radiates up your arm, you might have a diagnosis of carpal tunnel syndrome. So just to show everyone how, as a doctor, I diagnose it, these are some things you can do at home. It might be able to help you save a trip to a doctor maybe just to get that diagnosis. You can use what we call, there's a specific name to this called the Fallon test, but just prayer hands. If you can hold this for 60 seconds and you don't have any pain, numbness, tingling, or weakness, you've passed the test. But if you develop discomfort, if you develop pain, numbness, or tingling, especially if it radiates down your arm, that what we qualify as a positive test and increased risk of carpal tunnel. Also, you can flip it around and do the same thing in this other direction and hold that for 60 seconds. And if this is difficult for you to do, same thing, I'd be concerned that you might have a diagnosis.
Do my wrists need to touch like yours are?
I mean, they should be able to.
But not like, am I doing it right?
Yeah,
I don't know, now I'm nervous.
So why are we having pain if you have carpal tunnel? There's entrapment of what we call the median nerve. Usually we start with basic things like wearing a splint at night, especially if you're waking up with that pain. But if you're finding that it's changing your way of life and messing with your work, you can talk to your provider. There are different forms of treatment, injections, and sometimes even for severe carpal tunnel, surgery.
This is kind of fun.
I didn't like that one as much because it made me, I'm a little concerned now.
We're gonna test Will a little bit more during the break.
Yeah,
just to
I
make
have
sure.
a whole situation with my left arm and shoulder. I'm uneven. Like, we need to fix this.
I first need to get a triage nurse in here, but we're gonna start.
Spoken like a true doctor.
Yeah, absolutely.
Triage is a scary word.